Hello, my name's Angus Thomson. I trained as a molecular geneticist, but for the last 15 years, I've been working on vaccine acceptance and uptake, working with experts in the fields of human behavior, social and cognitive psychologists, anthropologists, and the like. I'm currently principal of Irimi Company, a small boutique consultancy that focuses on supporting countries to raise vaccination coverage rates and to address vaccine hesitancy. And I'm adjunct clinical professor at Indiana University, where I have a number of collaborations. Vaccine acceptance and uptake is a very complex decision that people make. It's affected by a host of different social and psychological factors and contextual factors. And in any specific context, in any community, in any single person, we may see a different mix of these factors at play. We know that it's a decision-making process that can go quite deep. It can be affected by our thoughts and our feelings, which may arise from the information or misinformation that we've been exposed to, but it can also be affected by things that are more deep within our psyches. So our beliefs, our values, moral values, the trust that we have in the system that's providing the vaccines, and so on. So it's important when we're looking to address vaccine hesitancy and uptake, that we understand which of these factors are at play in specific communities. Now, we have seen certain factors emerge as being more important from the pandemic. The big one is trust. Trust, for me, is the bedrock of vaccine acceptance and uptake. We've seen dependent upon the response that governments have made to the pandemic, either increasing or decreasing public trust in the vaccination programs, but more broadly in the health systems and the governments who provide those health systems. So trust is a key factor, and it has emerged as a fundamental factor from the pandemic. Disinformation and, importantly, the gaps in information that are out there has emerged as being very important. We've seen a so-called infodemic in parallel to the pandemic, in which colleagues of mine at Public Good Projects measured a 3 to 4-fold increase in the volume of vaccine-related disinformation on social networks within the first year of the pandemic. We've also seen, interestingly, what I call selective vaccine hesitancy. So people are hesitant about a certain vaccine or a certain brand of vaccine within, a group of vaccines against the same disease. That's quite new. In general, prior to the pandemic, people thought about a general kind of vaccine against a specific disease. We've seen the emergence of a moral value that we knew before the pandemic was associated with vaccine uptake, so-called liberty moral value, which pivots around belief in the rights of an individual, the individual. We've seen disinformation harness this moral value to get people's attention and to get people to share it. And perhaps a new one is political affiliation. There was very little evidence before the pandemic that people's positions in regard to vaccination associated with their political affiliation. But with the dramatic politicization of vaccination programs in many countries around the world, this has emerged as a key determinant as well. Barriers to vaccine acceptance and, most importantly, uptake. So a mistake that we often make is to assume that low coverage, low vaccination coverage is due to vaccine hesitancy or refusal. And study after study shows us that the most common reasons are not for people not getting vaccinated are not vaccine hesitancy usually. So it's all about people's ability to access vaccines or the vaccines to access them, people's ability to afford vaccines or afford to get vaccinated, because the opportunity costs related to vaccination can often be very high. Imagine the mother in rural West Africa who has to take a day off work to take her children 3 kilometers to the clinic in the nearest village, where she finds that there's no vaccine available because they've stocked out and therefore has to go back. She's missed a day of work. So affordability is important. Awareness is important. People need to know that there are vaccines that they're going to get. Acceptance is definitely a very big bit, and we can talk about a few of the barriers related to that. And then there's also actions that we can take just to get people vaccinated, or actions that are not taken, such as reminders. Once people are ready to get vaccinated, we still need to make it as easy as possible for them to get vaccinated. So looking from that perspective, a major barrier is access. People need to be able to get to vaccines, or the vaccines, most importantly, need to be able to get to them. And perhaps we'll talk about barriers and facilitators of uptake at the same time, because it's kind of relevant. A barrier to access is long waiting times, limited hours in which clinics are open, which may overlap with people's workday, etc. Solutions to this can be extending the hours to either side of people's workdays so that it's easier for people to go before or after work. It can be mobile clinics. We see a number of studies that have shown that mobile clinics are very effective, taking the vaccines to communities, especially in rural areas, in low middle income countries, but even in high income countries. Making vaccination as easy as possible is the number one objective that we should have if we want to achieve high immunization rates. We need to make it affordable. Where possible, vaccines need to be reimbursed, and that ease of access to vaccination touches affordability. The easier it is, the less it costs people in terms of time and money to get vaccinated. Vaccination communications campaigns are important. People need to know that vaccines are available, hopefully that they're free and available, and they need to know where they're available. During a pandemic like this, we know that risk communication is fundamental. There are basic risk communication principles that must be followed, that we know work. That includes transparent and regular communication about what we know and what we don't know about both the disease in the case of COVID-19 and the vaccines that were becoming available. Some countries did this very well, some failed to do this, and they had, in failing to do so, they eroded the trust that the public had in the health system, in the vaccination program, which did indeed lead to lower immunization rates. Trust is the most fundamental one, and in another interview, we'll talk about the importance of health professionals who are the most trusted voice almost in every context that I've ever looked at for vaccines. There are other trusted voices. There are community leaders, religious leaders. There are what we call micro-influencers, people within my group who communicate regularly to my community, whether it be offline or online. It's important that we understand who those trusted people are so that the communications that we develop are communicated through those trustworthy people. Trustworthiness is very important. It's not just about somebody being expert and competent. They must also be concerned about us. We look for our truths to come from people who we think have our best interests at heart. And then finally, in terms of developing the communications, we need to understand some of those socio-psychological barriers in specific communities and design our communications within that framework of understanding. We need to pass all of our communications through what I call a behavioral insights lens. But we also often, for example, for social media communications, need to pass it through different lenses so that what we produce is resonant and attractive and available to the people who are on those social networks, using techniques that retail companies use to create digital identities for our content. So you've got a few tips for what works there. The last one that we know works consistently is reminders. That's the activation in the 6A's taxonomy that I use all the time, that I mentioned at the beginning. Providing reminders or regular reminders just help people get over that last barrier between their intention and their action.